Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans. All right, welcome back, everybody, to another episode of Healthy Chicago podcast. I'm back. It's been a little while. Very pleased to be here with a very special guest who is going to be talking about, we've had a lot of recent media attention about one vaccine-preventable disease, measles. Dr. Stephanie Black is here to talk to us about another sort of hot vaccine-preventable disease that's been in the news. It's been in public health quite a bit. Thanks so much for being here, Dr. Black.
Happy to be here.
Let's start, before we get into the disease of the day, I'm wondering if you could introduce yourself, tell us what you do for the Department of Health, how long you've been there, and a little bit about yourself.
Sure. So I'm really happy to be on your podcast, by the way. This is really pretty cool.
Well, thanks.
I'm so glad that you're doing it. I have been at the health department for going on now about 14 years. Veteran, yes. And I have to say, and I can say this even after the pandemic and even after measles, that I feel really lucky to be in this job. So I work on kind of identifying outbreaks and stopping spread of contagious diseases.
Cool. Yeah. And your title is Medical Director of Communicable Diseases, right?
Correct.
And I remember actually calling you before I pivoted into public health. And I didn't really even know you, and I was just picking your brain. I was deciding about where to go with my career and asking you, what's it like being in public health? And I just remember you saying, this is the coolest job. I'm so lucky to be here. And it sounds like you still feel like that.
Yeah, I do. The way I got here is a little convoluted. People all have their own kind of journeys. Mm-hmm. I am an adult infectious disease specialist by training, and I saw responses to the anthrax attacks when I was training. I read a lot of Richard Preston for people, the Hot Zone, the Cobra event, kind of when I was training also. And there's a book in the band played on about the outbreak of AIDS when that started. And I just thought it was incredible that people would get paid for trying to understand how these diseases were spreading and try to stop them. And I really liked the idea of kind of having an impact on the community. Though sometimes I miss seeing patients on an individual basis.
Yeah, sure.
Tried to work that in a little bit, but anyway, it's really an exciting line of work.
Well, I'm so glad to have you here on this podcast. I don't know if I can call it my podcast, but I appreciate that. Our podcast. Let's talk about the disease of the day. This is Neisseria meningitis. Am I saying that right?
I always, when I'm telling people about the bacteria, I have to say, let me just write it down for 1 second so I can tell you how to spell it, because there's lots of different I's.
Yeah.
Like I like ice cube. But it is Neisseria meningitis.
Okay. And more commonly, referred to or understood as bacterial, often presents as bacterial meningitis, right?
Yes.
But
always.
not always. Not always.
Well, so there are many different infectious diseases which cause meningitis. Mm-hmm. And meningitis itself is an inflammation of the lining of the tissues around the brain and the spinal cord. And so that can be caused by viruses, like we know West Nile can cause meningitis. That's an example of a virus. Even there are fungal diseases that can cause meningitis, but this is a bacterial disease. And it is one for which we actually give prevention medicine for close contacts of people who are infected. So it's a big deal.
Yeah, and it sounds like this has been in the news quite a bit. can you tell us a little bit why, we're hearing about it in the news, why we're talking about it in public health so much right now?
Yeah. I mean, for anybody who's been unfortunate enough to have a family member or they themselves have experienced a Neisseria meningitis, it can be life-changing because people can have even limb-threatening infection because of the way the bacteria affect the bloodstream. So the reason it's been in the news lately is because there have been more cases of meningitis, of Neisseria meningitidis infections reported in the U.S. More at this time in 2023, the last year, since 2014, the most cases since 2014. So,
wow.
There's been an increase so far as of March 25th. There have been 143 reports of Neisseria meningitidis infection.
In the U.S.?
In the U.S.
Okay.
in 2024. And then that's as compared to 81 at the same time in 2023.
Oh, wow.
So
almost
really
like
on the
twice
rise.
as many.
Yeah. And I should just clarify, too, that Neisseria meningitidis infection doesn't just cause meningitis.
Got it.
So it can be in the spinal fluid, around the brain and the spinal cord, but can also just be in the bloodstream itself.
Okay.
So we call that bacteremia or sepsis.
Okay.
And it can also be in the joints. It can cause an entity called septic arthritis. And we call all of that invasive meningococcal disease.
So that's what we look for, predominantly here at the health department, is any sort of invasive infection of this bacteria.
Yeah, actually 1 in 10 people carry the bacteria in their throat.
You beat me to my next question, which is where does this bacteria live?
Yeah. So it's kind of scary to think about that. But that's what we call people carriers.
Huh.
And you don't have to do anything about it.
Yeah.
You don't need to know. Probably best not to know because, one of the mysteries of medicine is, why do some people develop invasive infection and others not? Now, there are people who are at increased risk for developing invasive disease.
Okay.
We know that. But the kind of the pathogenesis, like how it happens, is kind of a bit of a mystery.
Interesting, yeah. And so that, that's so different. The other hot topic right now is of course, measles still.
Yeah.
And, I think most people today in the United States will probably live their whole lives never encountering the measles virus, which is amazing, right?
Yeah.
And it says so much about, the power of our vaccine programs and public health here in the U.S., but this is very different. So, people will come into contact with this bacteria, but not everybody will become infected, is what you're saying.
Correct.
Okay.
And it's much different in terms of the way it's transmitted from one person to another than measles.
I see.
Measles,
you
can just be in the same room.
You can just breathe across the room and infect somebody.
Right.
Yeah.
This disease requires... We sort of say it as swapping spit, if you will.
Okay.
So people who live in the same household, if utensils are shared, if hopefully people aren't smoking so much these days, but cigarette is shared or other such items, or a drink, and then intimate kissing sort of partners. That way too.
Okay.
So we are always particularly concerned about significant others in terms of getting that prevention medicine to people as soon as possible.
Now, in public health, there are certain diseases and certain conditions where we at the health department have to act like immediately, like very quickly. This is one of those diseases, right? Yeah. And I think you mentioned a little bit before, but tell us why. What can we do after identifying a case to prevent further spread and further disease?
Yeah, so what we do is we reach out to, often the individual who has the infection is so sick they can't talk to us on the phone.
Yeah. Yeah.
At times we had an outbreak of meningococcal disease among men who have sex with men in 2015, 2016, and we would go to the hospital to talk with people, to try to kind of talk as soon as people could let us know, so that we could get their significant other, their social contacts. Because that's how meningitis will spread, through social networks. So we reach out directly to, if we can't talk to the patient themselves or the individual with the infection, we talk to their sort of next of kin or emergency contact.
Okay.
And we get a list of individuals who live in the same household, or college students can be at risk, and a roommate, that's who we'll be in touch with. And there are prevention antibiotics that are available. And it's actually can be as easy as one dose of one pill.
Okay.
Actually, sometimes kids need to get a shot, but it's that easy to get the prevention medicine, and you want to get it as soon as possible after the exposure to the individual. But it can be effective up to about 2 weeks. After exposure.
And it sounds like the urgency is not only to get people the antibiotic as soon as possible, obviously, but also in recognizing that this can be a really serious disease.
Yeah.
You mentioned, people sometimes when they're sick, they're so sick they can't even speak on the phone. Unfortunately, I know, people die from this disease quite a bit.
Yeah.
Yeah.
Of those with this current strain that people are talking about 18%. Yeah, of those for whom outcomes were known, about 17 of 94 people have died.
Jeez.
Yeah. So really important to know the symptoms to look out for. It depends. Like we talked about Neisseria meningitidis causing invasive disease in different sort of parts of the body. And depending on where the infection is, that's where you'll see, specific symptoms. So if somebody's developing meningitis from Neisseria meningitidis, they'll have the light might bother their eyes, bad headache. People talk about, bacterial meningitis. They say the worst headache of their life.
Yep.
A stiff neck, and fever. And these symptoms can progress rapidly. And people can develop a rash when they're in, as the disease is progressing. And so if somebody's changing before, a loved one's eyes, like really kind of becoming less interactive, lethargic, right, then they need to go to the emergency department right away.
Got it.
So, mess around with this. And for the other, for bacteremia, when the bacteria is in the blood, that can be fever, chills, but the same sort of, eventually people become lethargic and may develop that sort of this rash. And then septic arthritis is kind of joint pain.
Okay.
Yeah.
Okay.
Yeah.
So a couple different presentations to watch out for, I guess.
Right.
Yeah. And you mentioned, so in 2024, I think you mentioned 140-something cases in the U.S.
Yep.
Can you give us a sense of, like, what are we seeing in Chicago this year or recently? Does it match those trends nationally?
It does. So we're seeing in New York City seeing an increase. Nationally there have been an increase in cases. Some places have really had what they're calling outbreaks.
Yeah.
We are always looking for a defined population so that we can do an intervention.
Right.
Like provide vaccine where people wouldn't normally be indicated to get it. We are not seeing that, but we are seeing, so it's not, the infection's not occurring in one specific population that we can identify. Hey, there's just an overall increase in cases.
Okay.
And we're constantly looking at, what are the demographics? What is it looking like?
Sure.
Is it one population? Like we saw in 2015, 2016, there were about 10 cases, so 10 individuals who had Neisseria meningitidis infection. We did a big campaign among MSM to get that vaccine out to people.
Sure.
But so since then, there have only been really about 1 to 2 cases of invasive Neisseria meningitidis a year. But in 2023, we had 7 cases. And then again, this year so far, we've had 6.
Oh, wow.
So, and it's a different, so back when we had that outbreak in 2015, 2016, it was a certain serotype. It was type C. And now we were seeing type Y.
So these are like different strains of bacteria or something?
Yeah,
something like that.
different types of Neisseria meningitidis.
Sure. Okay.
And there are different types that are covered by various vaccines.
Okay.
If you have a college-age kid, they're going to be asking you about getting got to be asking about getting the Men B vaccine, meningitis B vaccine.
Okay.
Yeah.
Who should get a vaccine? Because there are vaccines against this bacteria, right?
Yes. Yep. And so the first dose of vaccines recommended around age 11, 12. And then it's recommended to get a booster right before, really around age 16, before going off to college.
I see.
And the reason for that is because one of the risk groups are people living in close quarters, like military barracks or college dorms, to liken the two, but people living in close quarters.
Sure.
And occasionally swapping spit, can be at risk for acquiring the infection. And so that is when people are recommended to get vaccine, in addition to people with certain underlying medical conditions. So people who don't have a spleen.
And why is that?
The spleen is very important in fighting off certain types of infection. That's an organ that develops. It's actually very fun to say spleen. Spleen.
Spleen.
Yeah, it's fun. But anyway.
Explain the spleen, please.
Spleen. It produces white blood cells and will actually target the bacteria for eating and getting rid of. So it's an important part of our immune system. Yeah. And so missing part of that immune system places people at risk for getting Neisseria meningitidis infections.
Who knew? I think most people consider the spleen as sort of a unnecessary accessory organ.
Very, very important. And actually, people with sickle cell disease have functional asplenia, so their spleens don't work, and they can be at risk for getting infection with Neisseria meningitidis. Very important for them to be vaccinated.
So even though we haven't in Chicago, at least yet, identified a group or a population that are specifically associated with these cases of Neisseria, there are certain populations of people that we know are at higher risk.
Right.
Okay.
Right. And people who are on certain medications also.
Okay. Okay.
Also need to be eculizumab.
Say that again.
Another
fun word to say.
Yes. Eculizumab and ravulizumab.
So what else is going on? So this is not just something in Chicago that we're seeing. This is something that the CDC has put out alerts about.
Yeah.
There's been articles written in the news about this. What is public health doing on a sort of a broader scale to understand this trend and sort of combat it, like push back against it?
Yeah, well, just like you said, CDC put out a notice to be, aware that this increase is occurring, and we're doing our best. Laboratories and clinicians are required to report every single case of invasive Neisseria meningitidis infection that they identify, so that public health can track down each individual and then identify their contacts and give this prevention medication to. And if we are able to identify a certain population at risk, we will do a vaccination campaign. Certain groups are already recommended to get, boosters, and people should talk to their doctor about whether they're indicated to get a booster for Neisseria meningitidis. We are also sending each isolate, each person who has an infection. The laboratory identifies, an isolate. They grow up the bacteria in culture. They send it to CDC for sequencing. So that's kind of understanding the bacteria at a genetic level. And in that way, CDC can determine, how the bacteria is changing, if it's developing antibiotic resistance. This particular, the sequence type that's increasing now is actually has not demonstrated resistance, although there is another group that has. So this is all important to track, and the local health departments submit to the state, which submits to the CDC, these isolates, and it is being tracked to follow. And there's really a national effort. All local health departments around the country are trying to sort of sort out, why is this happening now?
Yeah.
And, that question remains out there.
Huh.
Why are we seeing an increase? Did COVID, is there some immune modulating effect of, we just don't know. We don't know that. Yeah.
Still looking
pure
for some
speculation. We just don't know.
Well, this sounds like, an incredible amount of work just for this one disease. You've talked about talking to the patients and their families and coordinating with our state colleagues and people in the lab and passing information to CDC. Sorry.
I want to give a shout out to our investigators who are people who, they've been so critical in measles. We've seen the work that people do, but like really calling somebody and, saying, I'm with the Chicago Department of Public Health, and you've got to kind of gain some rapport, right? And people are in, difficult circumstances. They have this new infection or their loved one is sick, and you have to kind of really ask them difficult questions.
Right.
And sometimes people are really sick. Sometimes people have died.
Yeah.
And they're really tough conversations to have.
Yeah.
So got to give a shout out to the people who are doing that frontline work of, identifying who it is who needs to get that prevention medication. And also the epidemiologists who are, tracking what we're seeing over time so that we can see if follow trends.
Yeah.
Basically.
Yeah. Well, Dr. Black, thanks so much for sharing your depth of expertise, your 14 years of work with us at CDPH. I hope it's at least 14 more years. I always try to ask something at the end, a little bit of a lighthearted question or something else, but let's see. I don't know. Sometimes any good restaurants you've been to recently or fun neighborhood spots that you've discovered?
Oh, wow.
I know we've been a little bit busy. I don't know if I've even had time to.
I've actually been out and doing something fun. I guess I'll give a shout out to Lonesome Rose because they make some really good margaritas.
That's a fun spot.
I enjoy, time away. It's a little bit of downtime. I will give a shout out to them. Yeah.
Love it. Well, Stephanie, thank you so much for being here. This has been a real pleasure. I hope it's not the last time. You oversee so many diseases at the health department. You have so much experience and expertise. So I hope you'll join us again soon.
Thanks, Brian. Fun being here and love having you at the health department. So terrific.
Thanks, Steph. And thanks to everybody. We'll call it a day on this episode of Healthy Chicago Podcast. Subscribe, use all the links, do all that stuff, and we'll see you next time. And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.